Hi everyone, hope you're doing well. Everything is fine with you. Am I audible to everyone? All right, that's fine. So if there's any query, any question, you can always share in the chat section. All right. So basically, this will be the success sharing session for the recently successful candidates who attempted the March 2026 exam and who have cleared the March 2026 exam. All right. So of course, we wanted everyone to attend it, but a lot of candidates who did clear the exam were not available due to family commitments or job commitments, or maybe they wanted to stay anonymous. So of course, we respect everyone's opinion. And if they don't want to disclose themselves, that's totally up to them. So we can't force anyone. But thank you for those candidates who were able to make it and who are, I believe, attending the today's session. All right. So we'll start with the discussion for that. So we'll keep things simple, very organized. So first thing that we'll do is we'll share the success strategies of those candidates who did clear the exam. All right. And then we can have question answers for that. And then we can go on to discuss about streamlining the preparation of those candidates who are appearing in the upcoming future exams. Once that is done, we can have question answers for that. And then we can also discuss about the practical exam preparation and strategies, and then question answers for that. All right. So we'll go in a very organized pattern. All right. So I'll be asking those candidates who are in today's session, who have cleared the recent exam, to discuss their strategies. So once you're going to start speaking, I would like you to switch on the video for a short while when you're speaking so that the candidates know who it is. And also I should know who is speaking. So you can start with your name, where you're from, how did the Academy's course help you to achieve success, your preparation strategy, and advice and tips to the future candidates who are going to sit the written exam in the near future. All right. So that's fine. So who would like to get started?
Hello, Dr. Raza. This is Nikita here.
All right, Dr. Nikita, how are you? First of all, congratulations on clearing the exam.
Thank you.
I believe it does feel really good, and a huge burden is out. Yeah.
I know it is.
Can you
And
just
I'm
switch on your
glad.
video for a brief
Oh, yeah, sure.
moment so that we
The thing
know?
is, I don't mind, please. I might look a little sick because I've been down
It's
with viral
perfectly
for a
fine. Looks
week.
doesn't matter here.
So,
Don't worry
so
about that.
yeah,
Yeah. Thank you.
it's I'll
Okay.
be covered with. I know it's a very sunny day outside, but I'm very sick,
No,
so
that's
I'm
perfectly
just
fine. You're
covering
in Melbourne,
myself
I
for
believe,
it.
right?
No, I'm in Sydney.
You're in Sydney. Okay. All right. Yes,
Yes.
please discuss your strategy. Like I said, for every candidate who's going to speak today, we would like to know your name, where you're from, how did the Academy's course help you, your preparation strategy, and advice to the upcoming and the future candidates who are planning to sit the written exam. All right?
Yes, so firstly, my name is Nikita, and I have been with Dr. Raza for the March 2026, and also I'm from Sydney, like
Mhm.
Dr. Raza asked to mention from where I was
Yeah.
from. So basically, yes, this is not my first attempt, to be very frank. I am not that fortunate candidate who cleared her part one in one attempt, and it was not even my second. So I've given a couple of times.
Mhm.
And frankly speaking, I have had exposure to various mentors, and I'm not bad mouthing anyone here,
Mhm.
but when I came to Dr. Raza, I came just through a post on Facebook, and uh, my grades were not changing with other mentors, and I thought I need to change, I need to do something to get good grades and pass. So I came across Dr. Raza. I spoke to people who have already passed through you in their first attempt, the theory and practical in part one. So they told me, they gave me a gist of how your course would be like. And fortunately, before just joining, Dr. Raza spoke to me for 10 minutes, and he gave me an insight to, since I was a repeater, to
Mhm.
approach ADC in a different way, especially to focus on mock exams, because I kind of know all the theory right now since I'm a repeater here. So the mocks, which actually on the website mock actually helped me a lot, frankly speaking. And I have never solved such mocks ever with any tutors there. So I feel that was game changer. And the content, what you have in your entire portal is so concise that I didn't have to even panic to even think that, oh, I have 20 articles to read for queries or I have this much to read, because half of it I used to read through mocks. So if I have gone wrong in a question, then I used to read the explanation and done. It's half the article done there. So that was actually easy for me. And I kept giving your website mock, literally, I've given it 2 times and gone through your solved, I don't know what the section is recalled right now, but the solved MCQs with an explanation after every, I think there were 15 of them, I guess, the scenario
Yeah,
questions.
there's the past
So
questions folder completely solved. Yeah.
yes, yes, yes. So personally, I solved them 3 times. And the combination of both actually helped me in the exam. And really, this exam, March 2026, was not repeats as compared to what other March exams were. They had a lot of repeats, but this was not. This was literally basics, I felt, taken from textbooks. So, and I felt your
Now, I'll just
entire
interrupt you
portal and the
here for a
content.
second. Like you mentioned, that you have attempted this exam before as well, right? And you attempted the exam
Yeah.
again in March 2026. So, what was different? Of course, you have already mentioned regarding the course content, the mocks, and everything, how it is organized, how everything is solved. That's part of the course, right? That's what you are talking to us regarding the course that we conduct. But what about your experience while sitting the exam? Because that's also matters, right? Because a lot of candidates will have
Yeah,
all the knowledge in the world, but when it comes to the day of the exam, they collapse.
correct.
So
Exactly.
how
Yeah,
how do you
yeah.
think that you coped well? Did the mock exams and the questions and all the things that we had in the course made you confident to overcome that, or was it something different?
Yeah. So basically, first was the time management.
Mm-hmm.
That helped me a lot because in your mocks, it was, I guess, 100 questions in 2 hours, if I'm not wrong.
Yeah.
And we just have 70 questions in 2 hours. So I
Mm-hmm.
literally finished my exams in 1 hour, 15 minutes.
Okay.
And I had the rest 45 minutes to, see my flagged questions
Mm-hmm.
and just go through it. I, of course, didn't change my answers because I was kind of
Mm-hmm.
confident with them. But still, there were scenarios which were very confusing. And
Mm-hmm.
there were basic questions asked which were, tempting me to change. And I did change
Mm-hmm.
just one question. I still remember I just changed one question. And I don't know if it's right or wrong.
Mm-hmm.
So that's the thing with part one. But yeah, time management was something which gave me confidence because I had 40 to 45 minutes later to review
Mm-hmm.
everything. So,
Okay.
and then when I was reviewing these questions, I was very confident that yes, I know I'm right. And I mean, with scenarios, I know which scenario I was completely confident with, and I knew it was right. Because the first time you read, it's like, oh, you might have missed something. So,
Mm-hmm.
it's very important to go through it twice, and that helped me. And most of the scenarios, the way you ask us to look into a scenario and find what they are trying to ask you from that, I was trained through your mocks like that. And especially the doubt discussion, I used to drop a message on with you, and you answered it literally thoroughly. I said, this is how you need to think, and this is how you need to approach. That made everything easier. So yes, I feel time management, if you do really well with time management, everything goes easy in the exam.
Okay. All right. Thank you. Thank you for your input. And
Thank you.
again, congratulations on the success.
Thank you
Just
so
stay
much.
with us because we
Yeah,
will
yeah,
be
sure.
discussing the practical later on, hopefully, once we are done with all the candidates that we have today, so that the more input the future candidates get, the more that they can prepare themselves and be
Correct.
more confident. All
Correct.
right.
Yes,
Thank you and
yes, yes.
congratulations once again.
Thank you. Thank you so much, Dr.
That's
Raza.
fine.
Thank you.
Thank you. So who do we have next here?
Hi,
Doctor, I
Dr.
could
Raza.
I could go.
Okay. Dr. Sweta, can you just wait? We'll speak to Dr. Rachel. Um,
Yeah,
oh,
that's
wait
all
a
good.
second. Dr. Shalini, I'll just read a chat message. I'm Dr. Shalini from Malaysia. Apologies, I'm in Krabi at the moment and don't have a proper. So I'll then say I'm truly grateful to share that I passed my exam in my first attempt. All right, that's fine. Thank you. Dr. Shalini, and I hope you are having a good time after the exam results were declared. And I hope you enjoy your short vacation. And yeah, thank you so much. We'll get back to you later on. That's okay. All right, Dr. Rachel, please continue.
Good morning. I hope you can hear me loud and clear.
Yeah, we can hear you perfectly fine. Congratulations on clearing the exam.
Thank you. Thank you. So my name is Dr. Rachel Muir, as you've heard. I was able to clear this on my first attempt. And I was linked to Dr. Raza by a person who successfully also cleared a first attempt with you. And that's how I joined the academy. And I'd say one of the things that really helped to be able to do it was just to follow the portal. I went through, like you recommended, to read the reading material first, and then later to be able to do the mock questions and go through the reason why. And that is what really, I'd say, helped me. And yeah, I'm really grateful for the portal.
So what advice would you give the future aspirants who are planning to sit the exam? Since you cleared the exam in the first attempt, in fact, we had 38 candidates out of the candidates who cleared the exam. 38 of them were first timers who cleared the exam. So what advice would you give for those candidates who think it's impossible, don't get into the ADC journey, you can't clear it, the exams are tough, ADC is unfair. So any piece of advice that you would like to give to those candidates?
Yeah, I'd say with adequate preparation, it's possible, because really not like I am any special, but just by being consistent from the time I determined that I'm doing the exam, that is what helped me. So the consistency, like you always recommend, and just following through on all the questions, guidelines, the chart, then that is what I'd say is important, to just follow through. Once you determine you're doing it, follow through on all the guidelines given.
And what would you recommend the candidates the adequate preparation time? Like if there is something that you would say regarding on a daily basis, or how long the preparation time span should be in regards to the months before they plan to sit for the exam?
I'd say about 5 to 6 months is like the minimum one should dedicate to. If they're able to do more, the better, then they'll be able to do more practice. But if you, because of course we have other schedules, like I'm a student full-time, so it's a lot to do at the same time. But if you, at least 5 to 6 months is reasonable, and to make sure every day so you do something that contributes to ADC.
So keeping them yourself involved in the preparation on a daily basis, even if it's for 30 minutes, because not every day is same. Some days you might be busy, some days you might have other commitments, some days you might have something else to do. So it's just keeping yourself involved in the preparation and studying and preparing more on those days that you have more free time. That's what I do recommend the candidates. And yeah, thank you for that. Thank you for your input. Congratulations. And I hope it's the same for you with the practical as well. Hopefully you do get through it in the first attempt as well, and it's definitely doable. Many have done it, so there's nothing stopping you. Before you started the written exam, you might have doubts in your head that whether I'll be able to do the written exam. So you have done half of the part and you've done it quite successfully. So there's nothing stopping you from doing the second part quite successfully as well. All right. So we'll be discussing regarding the practical exam later on through the end of the session. If you are here, that will be good. But of course, I think you mentioned you had some commitments, but that's okay. If you're here, then you can. Otherwise, we will definitely be sharing the recording as well and make it available to all the candidates. All right. Thank you so much. And congratulations once again. All right. Who's next, please?
Hi, Dr. Raza.
All right, Dr. Shweta, congratulations on clearing the exam.
Thank you.
And I do understand it must feel really good. Please spare some time to share your feedback regarding your preparation, your name, where are you from, how did you prepare, how did the academy scores help you, and of course, tips and tricks to the future candidates who plan to sit the exam. All right, thank you.
Definitely. So I'm Shweta. I'm from India. I knew Dr. Raza through one of my friends who actually cleared the practical exam in the first attempt as well. Her name was Mariana. So she was telling
Yeah.
me how
Okay.
good you were, and this is my second attempt. So the first attempt, I was not enrolled with Dr. Raza. And again, I'm not bad mouthing anything, but I feel like I didn't clear it in the first attempt, and I felt like I had to change my strategy. And my friend suggested Dr. Raza, and with this mocks and resources, I was having doubts. I was like, oh my God, am I ready? But once I gave the exam, once I just followed everything on the portal, I did the mock exams, and then I went to the exam. I felt much more uh, uh, relaxed. I feel like that the mock exams gave me, because since it was simulated once, I could practice, like 10 mock exams before my exams. So I was not actually stressed on that day. And my brain was already programmed to, to take the exams. So that made it easier for me. And one advice I would give to all the candidates is like take the mock exam seriously and learn the concept rather than learn. I mean, like don't try to like by heart it. Learn the concepts, and then when you go to the exams, try to be more relaxed. And since you have taken the mock, you should know the time management and believe that you can do it, and you will do it. And if you just follow the post quotal, I really do believe that.
Thank you for that. Thank you for the input. One question that I would like to add here, just for our purpose, for Academy's purpose. Now, you did mention that this was your second attempt and you were with someone else before, and then you got to know about us from someone, and you got through the course portal, the mock website, and everything. Now, as you know me very well, everyone knows me very well. I'm not in competition with anyone, right? I don't want to be in competition with anyone. I just want to make sure that every candidate who's a dentist, who's willing to relocate to Australia, practice as a dentist, is successful in this exam. So, from your point of view, being completely transparent, what do you think we can improve?
No, I feel like to be very honest in the start, the previous academic I enrolled like trying to like give me more advice on a one-on-one basis. I was thinking that was an advantage, but after coming to you, you gave the input to us and you wanted us to do on our own, which I thought was not good for me in the start. But I right now from the point I have cleared, I feel like you can't do it if somebody is spoon feeding you. You need to have that determination in yourself to like constantly do it. And I wouldn't say there's anything for you guys to improve, because I really do believe that it's up to us to make use of the website, because if somebody is spoon feeding to us, we tend to take it to an advantage. And once you really want something, you go after it and try to do every research on your own, because like you said, all the articles is in the website. So I did the research on my own. So when I read it, I understood it better than you explaining it to me, Raza. Because like if I made a mistake, I go to an article, I read it, I know, oh, okay, fine, this is where I made a mistake. So that was good.
Well,
And
that's true,
what
actually.
my
I'll
biggest
completely agree with you on that because with these exams, some candidates, especially the ones who are entering the ADC era, they feel that it's just like their university exams, which is completely opposite. This is a licensing exam. It's not a universal or a university degree exam. So unless you have a determination to succeed, unless you put in efforts, because we can give you the best materials, we can give you everything. We can give you mock exams. We can give you literature, notes, everything. But if you're not serious and you're not going
yeah.
through the course content, not the course portal, the mock website, and you just believe that you purchase the course and you'll be successful, that will never hold true. You need to put in time. You need to put in efforts. And coming on to your second part where you said the ability to research yourself. Now, that's also very important. And literature also suggests that if someone goes into and search something themselves, they are more likely to remember that throughout their life rather than me spoon feeding you. You understand? So
Yeah.
sometimes when candidates do ask me the question personally or in the WhatsApp group, I tell them, please go check TG this section. Why I say that
Yeah.
is because I can even send a picture of that section in that group. It's not hard for me. But when you go and
Exactly.
open the TG yourself, you see this is what is mentioned. You will always remember. And you will also remember that if some other question comes, which is similar in concept to the one that you asked me, you will always remember where to go back and check. So that becomes very important for the candidate to understand that this is an approach that you need to take. Built in that concepts with you, know where to search. We have all the ADC reference books in the course portal. We want the candidates to utilize them in a very smart way. All right. Anything else
Yeah,
that you would
that's
like to add, please?
The one thing which I like to add is like you said, consistency is important. You can't give your 100% every day. I was working a full-time job in Australia, and I was trying to be consistent. There are days where I was not consistent, but the next day I will pick up and try to do more with the time I have, and always try to do your own research. And you can always ask the questions in the group, and you always clear it out. But I would always suggest, if you have more doubts, just go to the article and read, so that it when you make a mistake, you remember the mistake, so you will never make the same mistake again. So make more mistakes when you're doing the mock, and so that you can learn and be better in the exams.
All right. Thank you. Thank you for taking time out on Sunday, and congratulations once again. And
Thank you.
hopefully you have the same journey with the practical as well.
Yeah,
And
thank you so much,
hopefully
Dr.
you turn
Raza.
out to become a successful dentist very soon. All right.
Thank you.
Thank you. Thank you. Take care. And like she mentioned as well, please remember that the failure candidates who did fail the exam, failure doesn't determine anything with these licensing exam. All right. It's a learning outcome. All right. And in these professional exams, don't take failure as an absolute. It's always relative. It will change if you want it to change, of course. If you don't want to change and if you don't want to become serious with the preparation, nothing is going to change. So the failure is always relative. With the academy, with the March 2026 results which were declared, the academy till date, till from 2016 onwards until 2026, we had 1,946 candidates who have cleared the exams. Now, if you ask me if these 1,946 candidates who did clear the exam with the academy's courses, were they all first timers? No. More than 50% of the candidates were not first timers. So please remember that failure in the ADC exam or any professional exam is relative. It's going to change, but it will only change if you want it to change. All right. All right. Thank you. So who we do have next here, please?
Hi, Dr.
Sharing their
Raza.
experience. All right.
Can I go next? Yep.
Yes, of course you can. Just please switch on your video for a second so I know who's
Yep.
speaking.
Hi, Dr. Raza.
All right. How are you?
Hi, I'm good, thanks. How are you? So, my name's Lana. I'm actually here in Sydney, for 3 years now. I found Dr. Raza by myself. I was never recommended to by anyone, but I've seen all the other review groups as well. But I figured that with Dr. Raza, it's much more straightforward. There's not much how would you say, like flowery words, or it's just straightforward, this and that, this is what you need. So I decided to go ahead with Dr. Raza. And honestly, this is not my first time to attempt for the exam. This is actually my third time. And basically, I would share that for the portal, I don't think there's any changes that needs to be done. It's more of how you actually go through the portal. Everything's there. You don't need to. Honestly, I don't think you need to ask Dr. Raza, because everything's in there. You just have to look for it in the portal. You just have to go through the mock exams. There's a lot of mock exam questions in there. Everything's there. Past questions, even questions from the what ADC released, the old questions that's taken out of the actual exam. It's actually, some of them are actually in the questions that Dr. Raza has put into the website. So yeah, that's it. I think that's all I can say.
All right, that's fine. Thank you. Congratulations for that. So you mentioned that this was not your first attempt.
Yeah,
So
it's my third time.
just
Dr.
to know
Raza.
your personal circumstances, because there might be candidates who are in a similar situation
Yep.
and things might not be working out for them. So what do you think was different that you did this time, whether in regards to preparation or in regards to sitting the actual exam day itself?
Yep.
What was, if there is anything that you can add to that? Because like I said, this session is not for just only the successful candidates, it's for those as well who are planning to sit the exam, who have not been successful in clearing the exam. So what do you think was different that you did this time that helped you achieve success?
Okay, so If in the portal, I think you introduced the new way of answering questions. You know how there's a timer and then we have to answer questions like in the actual exam. I think that actually helped me with how I manage my time, as what the previous successful candidates have mentioned. Time management is really important. I think the past two exams I did, I wasn't managing my time well, so I always ended up with only having 15 to 20 minutes of reviewing my answers, and it's not really enough. For 70 questions with 2 hours, I think it's best that you have at least 40 to 60 minutes time remaining for you to review everything. And I think that new way of introducing mock questions in the website helped because it helped me manage my time well. And for my the personal things I did is, yeah, basically because I'm working as well, not full time, but I'm working. So every day I allot at least like an hour to read or at least answer mock exams, mock questions. And then on the days that I'm more free, that's when I really focus and I give at least, I don't know, the whole day, I think, to study Saturday, Sundays. So, and I think this time, comparing to the last two times that I have sit in the actual exam, I prepared myself. I think I focused more and relaxed myself. I think I'm kind of meditated. I feel like I have to just focus and relax, because if I'm not relaxed, then I'm not going to be able to answer all the questions correctly. So being relaxed while before, like the actual an hour before the exam, really helped me, answer the questions properly.
All right. Thank you for that. And thank you for the input. Congratulations on the success. And I hope it works out for you with the practical as well.
Yep.
Don't delay your preparation for the
Yes.
practical. Please get started.
Yep.
Although I do believe that the written exam is now extended, which means the validity is extended to 5 years.
5 years, correct.
But please take every opportunity that the ADC gives you. All
Yes.
right. That would be my piece of advice, especially considering that you're in Australia. All
Yes.
right. Because you don't need to bother about coming to Australia, applying for the visitor visa and all that. So please take every opportunity. And being in Australia, you have ample of time to prepare as well. All right.
Thanks,
Thank you
Dr.
for the
Raza.
input. Thank
so
you.
much.
And in regards to the other aspect that you mentioned with the mock exam website, yes, that was the first time in March 2026, for the candidates of March 2026, where we introduced the mock exam website. It was not there before. Before we were having the mock in the course portal and then discussion of that. But then we found out that because not everyone was able to attend the discussion session because of time difference and all that. So we made the life of candidates very easy by making a mock website with all the mock exams, with the question answer, simulating the actual exam of the ADC, and then having the complete answers, explanation, and then also the discussion video. So I've mentioned many times before, there is nothing that you can go wrong with the course. The only thing that can go wrong is if you're not serious about it. All right. Thank you. Thank you, Dr. Lana, and all the best. Congratulations once again. So who's next, please?
Hello, Dr.
Doctor, I can go next.
All right. So this is who am I speaking to, please?
Dr. Divya.
All right. Can you switch on the video so I can see you for a while?
Yes. Hi.
All right. How are you, Dr. Divya?
I'm doing fine, sir. How are you?
You're still on vacation in India, or have you come back?
Yeah. No,
Still
I'll
there?
be going back end of April.
Okay. All right. You're going to USA, you mentioned, right?
Yes.
Okay. All right. Please contribute towards your success and helping the future candidates.
Yes, doctor. So my name is Dr. Divya Pasana. I have completed my BDS and MDS in prosthodontics from India. And I recently got married last year and I moved to the US. And my friend, Jeanette, she recommended you. And I joined your course right away. I honestly am not the kind of person who, focuses and relies on social media as much. I really wanted to trust somebody who honestly passed through your course. So I'd like to start by thanking you because your course portal was so adequate. It was so appropriate. I didn't even have to refer to any other notes. I didn't even have to refer to anybody else's free mocks. I was with your course even in the previous attempt, and I took it for this attempt as well. And I started my preparation. I used to prepare for at least 4 to 5 hours per day and consistently for 6 months. I think 6 months is minimum. And as the days come closer, you can, increase the hours to at least 6 or 7 hours because everybody has life commitments. Secondly, I followed your the in your orientation video, like you said, I started group wise. So each and every group, I used to read the articles, I used to read the matter, and then I used to solve the mocks. And later I went to the bigger mocks. And last time that you introduced your um, online the mock exams, which was timed. So that helped me a lot. So in comparison to the last attempt and this attempt, I would like to say that in the previous attempt, I tried to do as much as possible. uh, you can say I try to, read TG a lot. I try to read ICG a lot. Try to go through a lot of your past papers. I try to go through a lot of mocks. But this time I made sure that I used a very unrushed approach, wherein even if I'm solving just two super mocks in a day or just solving two mocks on your website, I made sure that I go through the answer key, and at the same time, I also go back and read the matter so that, I understand better. Because I had the added benefit that I gave the exam in September and this is my second attempt, I obviously knew better. Therefore, I feel like I understood better and I honestly asked you more doubts this time. So that was a big change for me. I tried to relax and I tried to take everything very slowly and try to understand better. Yeah, so
Okay,
that
all
was
right,
the
that's
only
fine. Thank you for
difference.
that. And now, in regards to the one thing that you mentioned here, that it was your second attempt, of course, you tried to have an unrushed approach and you tried to comprehend more towards the question, understand them, understand the answers. Now, what would you like to say to those candidates who did set the exam for their first attempt? Should they give up?
No, doctor. I personally, in the last attempt that I gave after the results, I think I took like maximum 1 week to get back in track. And
Mhm.
then I just decided that I don't want to waste more time feeling upset because as I've decided that I have to go forth with this, so I just snapped back quickly and I started the preparation immediately. I started reading TG4 because you had already told us and you had released the TG4 in the course portal long before any of my other friends from other courses had already started, so which was an added benefit to us. So I started reading immediately, and there is no point of giving up. It's only hard work. It's only revising more and more, revising TG, revising, you can consider ICG, trauma, or for the matter of fact, revising more and more in the mocks. I think the more you practice, the more you become efficient, the more you try to read better. And like I had already mentioned to you, you do not spoon feed, which is a really added benefit because it makes the students less lazy. So apart from the answer key, like your answer key was already very elaborate. So I used to go back to the articles before asking doubts to you. In the process, I already used to, get the answer correct. So that was a big plus point.
All right, thank you for that. Any changes that you think we should make?
No, doctor. I think it was just perfect.
All right, that's fine. Thank you. Congratulations once again. You mentioned you're a
Thank you,
prosthodontist, right?
doctor. Yes, doctor.
All right, so you have a lot of scope here in Australia. Hopefully,
Okay,
once
thank
you're
you.
done with
Because
practical.
honestly, the complete denture questions also in the beginning, I used to, because something in the colleges, this kind of teaching is really not followed back in colleges. So it's a very different approach. So the first time that I gave the exam, I used to feel like I have seen this question, meaning the answer is also going to be same. But the answer changes every time the question changes. And I used to get a lot of wrong answers for the complete denture questions itself because maybe I wasn't reading well.
Yeah, that's true actually, because the colleges and the degree exams, they focus more on the theoretical aspect. ADC focuses
Yes,
more on
completely.
how things are done clinically. And like I mentioned earlier as well, that whatever the ADC, like ADC, no matter how much you criticize them,
Hmm.
whatever the ADC asks in the written exam as well as the practical exam, this is something that you are going to witness in your day-to-day life of dentistry
That's
practice in
correct.
Australia. Now, for example, even just last week when I was working here in the clinic, We saw patient with, methamphetamine use. We saw pregnant patients, not willing to take X-rays. We
Mm-hmm.
saw patients with other dentists who had done the root canal treatments and they were not advised about crown. So you understand where the ADC comes up with the questions,
Correct, correct.
because this is something
Definitely.
that you will always see in the live practice that you do, the live practice that you do on your patients, and it makes you so much ready. So that's why ADC focuses so much. In fact, adding to this, we had one patient who was on denosumab who just fell off and had his central incisor fractured, and he just was for 6 years. He was on denosumab. He didn't want to extract. The tooth was fractured at the gum level. I did give an option of extraction because RCT was not possible. It was too badly fractured. But then, in consultation with the GP, I sent the letter to the GP. The GP said that it's up to you whether you want to go for extraction, because you can inform the patient the risk of bronch. Then I did discuss with the patient. He was too old. He said, "No, I don't want to bother with my life with bronch this at this time. Although the chances of bronch is very less and very unlikely." So what we did is we just built up. I did a pulpectomy and just built up the tooth with GIC, just to
Correct,
make sure that it stays as long as possible. So that's why you
correct.
see the ADC asks so many questions like this in the written exam, because they want to indirectly prepare you for the live practice that you will have. And these concepts will help you a lot. Or even if you are not, the clinical aspect, the clinical dentistry, you will learn. Even if you don't know how to do root canal treatment, you will learn. Attend a short course of 1 week. They will teach you how to do root canal, or just be an observer, or go for observership at any practice. They will help you learn with all these things. You don't know how to do crown, they will help you. But you can't get back to what you have learned in
The
the written,
basics.
right?
Yes,
So
yes,
that's
that's
why they
correct.
focus so much on the written exam, because now because you'll start your practical journey, you will realize the practical exam, the practical components that they have is so much less compared to what you're doing in the written exam, because there are just 16 stations that you need to master. And if you come to the clinical aspect, these are 6 tasks that they ask in the exam on the mannequin, just 6 tasks. But that does not mean that those are the only 6 tasks that a dentist does in Australia. No, we do hundreds of tasks, right? Hundreds of procedures. But ADC doesn't care about that, because they will know that there is a compulsory CPD requirement every 3 years that the dentist needs to fulfill. You will learn through that. Even if you don't know how to do implants, class 2 fillings, RCTs, all these things you will learn with time. But the theoretical part, once it is done, it's not coming back, right? So that's why the ADC
That's
wants you to
correct.
be a master of the theoretical concept through their ADC written exam, and then focus on later. All right. Although that's a huge different discussion that can go long and long.
Doctor, one more thing I would
Yeah.
like to say is, in one of your previous videos, you had, emphasized on knowing who your mentor is.
Hmm.
And I believe, honestly, taking your course in my second attempt made a huge difference, because the questions, which were based on ethics and professionalism and, all the medical legal cases, I feel like you, being a practicing dentist in Australia, and you actually taught us the exact same thing. So those questions, I think I could answer much better this time.
Actually, that is true, because we do see, I'm not pointing out at any mentor or anything or any academy, but we do see a lot of candidates who come to us when they question us. So initially, before joining the course, they say this and that. I always tell them, you see, you can't learn from someone who has not gone through the same path. All right.
Absolutely.
You won't learn to drive a car from someone who has not sat in the car. You understand? And
Absolutely.
of course, ADC examiners and the ones who are setting the question papers are clinicians. They are dentists,
Yes.
or they were once
Yes.
dentists in Australia. So they will always focus on those types of questions which are relevant to the practice of dentistry in Australia. Ethics, health promotion, professionalism, this plays a huge part, because you will see a
Correct.
lot of patients who are behaving this way in Australia. In
Yes.
subcontinent, in the parts of the world from which you are and I am, we don't see a lot of these patients. We don't see patients with mental health issues. We don't see patients who have psychiatric problems, because we feel everyone is the same. But in
Hmm.
Australia, they do focus with these things a lot. Professionalism. I think last month I had a patient, because we go with the examination with examination, scale and clean and fluoride. She said, "I want to stop at scale and clean. Please don't apply fluoride for me." Now, what I can do? That's the routine procedure. She said, "I don't want
Yes.
fluoride,"
Yes.
right? because we apply topical fluoride gel for every patient who comes for 6 monthly scale and clean over here in Australia. That's a concept you will learn once, inshallah, you'll start practicing. Now, what can I do for this patient? I made her aware. Because we have desktop and laptops at the practice, I showed her this is the benefits. I told her these are all myths and everything. In 15 to 10 minutes, she agreed. She said, okay, let's go with the fluoride. But it's how you manage the patient, right? Some patient will say no because they've been taught that the same thing with holistic practice. You have to respect their opinion. Okay, no fluoride,
Yes,
that's fine.
exactly.
So everyone is different, right? So you have to, and this is what
Definitely.
you have to learn with time. And hopefully you will once you start practicing. The start is hard. Once you blend in, things will get clear. All right. Thank you for
Yes,
that. I
doctor.
won't
Thank
take
you so
much of
much.
your time, and congratulations once again. And hopefully everything works out well for you in the practical exam as well. All right.
Okay, thank you,
Thank you.
doctor.
So who do we have next here?
Hello, Dr. Raza.
Hello,
Could you hear me?
doctor. Okay.
Okay. Dr. Clementina, you can just wait if that's okay. Yeah. Who's the other one?
Yes, Dr. Raza.
Yeah.
Sorry, I'm unable to disclose myself as I mentioned to you earlier, just
Mhm.
because of my personal reasons.
That's fine.
Thank you so much, first of all, for this has been a really big opportunity to get to know you.
Mhm.
I got to know you only through the social media on Facebook pages, just
Mhm.
randomly. But I'm so grateful for I chose you. I live in Melbourne, and this is my third attempt. So the last two attempts they were around 5 years ago. So there's been a gap of 5 or 6 years now.
Mhm.
So I could also tell I'm a first timer because the previous two attempts, it was just my own self preparation. I
Mhm.
wasn't guided by any academies or even friends or a circle.
Mhm.
So it was just my own preparation.
Mhm.
So this time it was completely new. It was a big eye opener for me about what ADC was
Mhm.
and what the actual exam structure is. So definitely, I would suggest like every candidate go through your course portal, starting from the introduction videos up to the mock exams. So as you have mentioned in your first videos, how you start the course, read the introduction, go through the course subjects, and then the mocks for each subject, and then the grand mocks. So that is how I did myself. My preparation was hardly with the family and work commitments. It would have been hardly 1 or 2 hours a day. But then when when you go across the core subjects and then do the mock simultaneously, you know where you stand. But by the end of 3 to 4 months, you would randomly tend to forget what you have read through
Mhm.
during the initial, reading all the core subjects, the each and every articles and the books that you have read. But then when you start doing the mock exams and with the answers that you have provided, when you go back to the article, you get more clarity. And that's what, as all the previous candidates have mentioned, the repeat reading, like as you have mentioned many a times during our discussion videos, keep repeating the articles and repeat reading at least every half an hour you spend during the day. It makes a huge difference because every time we read, we get a different perspective of the scenario that we encounter. And also the videos that you have put up at the end of every discussion,
Mhm.
it makes a huge difference because when I have, as I already mentioned, soon after the exam, when we sit at the exam station, the exam table, and we read the scenario, I actually hear your voice, like how you have explained the scenario and the answers for every different situation and how it changes, dramatically, because we think, okay, it's just the usual start and end of a scenario, but then there's a small trick to it. For example, the high risk patients and how you categorize them. So when you keep listening to the videos, even when you're busy with work and everything, when you keep listening to the videos repeatedly, it makes a huge difference. And the time management. next would be the time management because of the mock exams, and also how you have structured the PDF and the mock website. The time management skills has drastically improved because the 100 questions is not at all easy for us when we first attempt the exam. But then as we go across, we keep repeatedly doing it every single time, you get to do it within half an hour and 40 minutes. So that makes a huge difference when we sit at the actual written exam day. And
All
the
right,
other
thank you
thing,
for that. And in regards to us as an academy with the course that we run for the written exam, do you think that there is something that we can change?
I think it's pretty much, everything has been covered well. But the only thing from my end, if I would suggest, is like how we have the discussion videos,
Mhm.
and soon after every mocks or after any, for the discussion videos alone, because when you give a clarity for a scenario and the situation, that's what we would like to perceive as candidates.
Mhm.
But then the videos have a lot of interruptions from all the candidates whom we participate during the
Mhm.
discussions.
Mhm.
So that actually kind of interrupts like what
Mhm.
perspective we get, and then we have to start making notes. So I would suggest, like as you mentioned, like mute your microphone, or then when we
Mhm.
have the discussion or the
No, well, that's
answering.
true actually. The thing is that certain videos you will find them that there are certain questions that I have not muted.
Yeah.
The reason for that is because when the candidate asks the question, which I feel is relevant for others to know, I don't trim that part of the video and
Hmm.
keep it as it is. Because, of course, some questions, some things might be clear to some candidates in the first go, but some candidates might have a similar question that they would like to ask. So when you see candidates interrupting me and asking a question and then me answering them back, there is a reason why I have included that in the discussion videos itself, rather than muting it, because it might help someone who might have a similar doubt. But I understand where you're coming from in regards to, because then it interrupts the flow of certain candidates when they are going through the discussion video. But yes, we'll take note of that and we'll see if we can do anything in regards to that. All right.
Yes,
Any
thank you
tips you
so
would
much,
like to
Doctor.
give to the future candidates who are planning for this journey?
My suggestion would be just, start watching, like if they have enrolled in your complete course, as you have mentioned, like, from the beginning to the end, follow the flow of the course that you have, set up, because that really helps us. Because like some of us, when we are very confident with certain, materials or articles, because we've already read that many a times, we tend to go to the mock and start solving the questions or the previous past papers or whatnot. That interrupts the basic idea, and then we tend to have the wrong ideology of the entire scenario. Just go with the flow and start as you have, because it is in a very stepwise
Well, I'll
pattern.
definitely agree with this. Sorry to interrupt. I'll definitely agree with this because certain candidates, when they join the course, they will just want to go to the mock website and the mock section of the portal and just start doing them. And then once they are done with that, they say that we didn't even get 50% of the questions right.
That's
And
true.
they start feeling a bit demotivated. Now, I would definitely suggest what Doctor just mentioned is that please make sure that you follow the sequence of the course portal. There is a reason why things are done a specific way, right? If we didn't want you to follow the sequence that we have in the course portal, we could have given you the course content in any random manner, right? But we have a sequence. There is a reason why the sequence is there, so that first you start building the concepts, first you start having the knowledge, and then you start jumping on to doing the mock exams in the course portal, the past questions, and the mock website. Because there are roughly around 6,500 to 7,500 questions, scenario-based questions in the course portal and the mock exam included. So I won't want you to just jump into doing the mock exams and all the questions first. I want you to build knowledge so that you have an understanding. Some candidates will be quick with that, which means they will be quicker in adapting to that knowledge. And some candidates will already have that knowledge, which is perfectly fine. There's no harm in going through the same thing again, because it might make you go through things quicker compared to someone who needs more time to sit down and understand the concepts. All right. Thank you so much, doctor. And I
Thank
hope everything works out well for you in the practical exam. And I hope you have a very successful journey in regards to the practical exam as well. All right.
Thank you so
Thank
much,
you.
Dr.
Thank you for
Raza.
your
Thank you.
time. All right. Who do we have here? I think Dr. Clementina would like to speak now. Thank
Yeah.
you.
Hello,
Thank you for
doctor.
taking out time. I do understand it must be very early for you. Thank you for
Uh,
waking up soon on a Sunday.
Thank you.
And I'm sorry for spoiling the Sunday for you. All right.
No, it's okay. So yeah, I'm Clementina and I'm from Italy. I passed my exam in the second attempt. And what I think I've changed from the first attempt, it was that I did a lot of theory in the first time. So what I can suggest, maybe what it helped me was to make notes of the different theory part. And so it was easier for me to go through it in a quicker way, because yeah, it's really extends the theoretic part. And then the second time I focused more on to do more mocks. And I think this was the difference. Like the second time as you suggested many times, I studied more in a manner that in a smarter way. So I was going through the questions, and maybe if then I had doubts on that questions, or I made it wrong, I was going back to the theory. And so yeah, this was really that the answer was really stuck, like was going to stuck in my mind, because yeah, I was basically yeah, as you said many times, studying in a smarter way. And also what I feel is that making a lot of mocks, also I made notes about mocks, so the reasoning behind every question, this helped me a lot as well. Because after, for example, in the exam we had in March, maybe it was the questions were more like general, more general subjects. So maybe we couldn't know the answer, but what helped me a lot is that I was able to solve the question, because I understood, maybe thanks to the mocks, how to reason, and also how to basically understand when the question was there were like some tricks and some stuff that wants you to make the wrong answer. So I think, yeah, practicing a lot was really helping me this time. But of course, I had built a lot of the theoretic concept before as well. So yeah.
All
This
right, thank you
was
for that. And I do understand one thing that I would like to point out here is that in the WhatsApp group that we had, I saw that you were quite active in that, which showed your interest towards answering and helping the other candidates and also solving doubts at times, which is also very beneficial because it's not only about you helping others at the same time is also very valuable in this journey. All right. And asking questions, gaining clarification, asking for references, clarifying the mistakes the other candidates make, which shows your character as well, and which also showed in your results. All right.
yeah.
Thank you for that. And
Thank
hopefully
you.
everything turns out well for you. You have asked me a few things in the message regarding your preparation for the practical
Yeah.
being in Italy. I don't think so that you need to be bothered about it. You can have everything that you want delivered to you with the mannequin, with the home setup, and keep practicing. So I don't think so that would be a hassle. All right. Being
Okay.
in
Okay.
Europe, all these big companies, One Dental, Nevada, they do deliver to Italy. And I don't think so
Okay.
that would be a problem. All right. But of course,
Okay.
you can always message us regarding any help, any queries that you have, and we'll be happy to help you. All right. Thank you so much
Okay.
for your
Thank you so
time,
much, doctor.
and
Thank
all the
you.
best and congratulations once again. All right.
Thank you.
Okay. Okay. So who do we have next here, please? I think we have Dr. Ariba. I can see her name.
Hi, Dr. Rizzo. Yeah,
Okay, that's Dr. Ariba. All right. How are you? Congratulations
good.
on the success.
Thank
And
you, sir.
thank you for attending the session. Please just spare some time and provide your feedback regarding your preparation, the course content, how the course helped you, and how some tips to the future candidates as well.
Yes, sir. So this is my first attempt. So I'm currently doing a PhD in Australia as well. So I didn't have a lot of time to study. Just before the exam, I would say like 3 weeks before, I just went over like the mock website, attempted as many MCQs as I could, and just tried to go with all the answers again just to get a feedback from those. And my preparation was a bit haphazard, so I won't be able to guide as properly as others. But everything is on the portal itself. Yeah. And for
So
the
how long
exam,
would you say that you prepared? I do understand there were a lot of things, and being a PhD student is not easy, dedicating time towards ADC as well. So how long would you say that you prepared for the exam? And since it was your first attempt, you were able to clear it in the first attempt. What are those things that you felt were very important, without which success in this exam would have not been achievable?
being consistent, I guess, would be more important. So about 6 months is a good time to just go over all the course portal. But for the last months, I would say that just attempt as many mocks as you can. And once you've attempted it, go over all the questions, answers that you selected, and go over like why you selected some ones. So you might be getting a lot of things wrong. And then I went over TG4 at least 3 times, and the ICG like 2 or 3 times as well. And for the exam itself, I didn't stress much on the day because I wasn't really sure that I had good enough preparation. So I just was very relaxed with the exam itself.
All right. Okay. And in
Yeah.
regards to the mock website, like you said that you spend a lot of time doing the mock website, the TG and the infection control guideline. So how would you like to emphasize the importance of that in regards to the actual exam itself?
Sir, so many of the cases, they were similar in the exam as we have on the mock website. Even for the grand mocks, they're a bit more difficult to the actual exam. And then, even if the questions they were repeated, I would just go over them because ADC likes to switch things up. So I attempted it the first time very fast, but I had enough time to just look over MCQs. But you would see like 1 or 2 words would change your answer. And just like how to rule stuff out, even if I wasn't sure about some of the stuff, like I couldn't go over ortho and prosto a lot. So I was confused when I got those answers, but just through the way of ruling options out and how you explain in your videos. Yeah.
All right. Thank you for that. Thank you for sparing time out. Congratulations once again. And I hope you start with your practical exam journey as well as soon as possible. And hopefully you get it in the first try. All right. Nothing is stopping you from achieving that. Thank you so much. And thank you for the input. All right. That's fine. Thank you. So who do we have next here? I can see Dr. Amna. Is Dr. Amna Zahid?
Hello, Dr. Raza.
Hi, Dr. Amna. How are you? Congratulations on clearing the exam.
Thank you so much, sir. Thank you so much. It still feels unreal because I wasn't expecting much. I was like preparing myself for the worst case scenario. I had like a few friends of mine who gave the exam and didn't clear it for the third time as well. So I was like very skeptical. Plus, I did enroll in another course. But I wasn't very confident with that. And the good part about Raza's course was it's not time thing. Matlab, if due to some circumstances you're not able to give the exam in the attempt you planned on, you still have the course content available until unless you actually sit for the exam. So this was really helpful. And it just feels unreal, and you have to trust yourself, and it feels unreal, and it gives you a lot of anxiety. And I feel like the exam is all about handling your stress and
Hmm.
just fingers crossed and do your best you can and answering questions as
Was
why
this
rather
your
than just
first attempt?
yes, it was my first attempt.
Okay, all right. Yeah, please continue.
Yeah, and then the best part is I also stated in the message, okay, a slight strict nature of yours that redirected us, all of us, to go study, go focus, go read it on yourself, go evaluate yourself, go find it yourself. That really helped because, as you said earlier as well, okay, when you find answers yourself, you also find answers to many other questions, and it opens a gateway. And it opens how you think practically and clinically rather than cramming anything and spoon feeding. So yeah,
Now, you did mention that you had a few friends that did not clear
yeah,
and you were able to clear. So, of course, you do
yeah,
guys have discussions amongst yourself. So, what
yeah.
advice did you give them? Sorry. Yeah.
Mocks, and answer the why first, and then look for why the answer is so. Because although the answer might be right and you have thought it the right way, there might be something that might change the answer or add into the scenario. So you have to find answers your way. If you blindly go with the mocks, that's not going to work. If you're blindly going to keep on studying core subjects, that's not going to work either. Because I went through the course twice and then I just did mocks. I did many mocks. I did around 5 times, and the website I did around three, two, and some 4 times. So that did help because the first time when I attended some questions, I was like, oh, I this is very easy. But the next time I attended, I was like, why am I getting it wrong the next time? Because you forget the answers you already did right the last time. And many questions were similar, but with a few exceptions. And also, when the website was live, you stated, okay, do one mock a day with fresh mindset rather than just doing it for the sake of doing it. So yeah, I think this is what helps. And keep on believing, okay, it is doable. It's just a lot difficult, but doable.
All right. Thank you for that. And any
Thank you so
advice you would like to give us?
None, sir. It was a very good structured course, and I think amazing.
Thank you for that. I believe you are in Middle East, right?
No, I was in Middle East, then I moved to Pakistan, so now I'm currently in Pakistan, now looking and exploring ways how can I get my can I move to Australia before giving my practical because I really want to I fund in myself. Living in
Mm-hmm.
Pakistan is just like impossible.
Mm-hmm.
Um, so
Okay, that's
I
fine.
might,
So
yeah.
what do you plan for the practical now?
For the practical, I am looking for visa options. So if somebody can sponsor me or I can work as a short course. I don't really know what can be done because
Mm-hmm.
as much as I've talked to some people, they're like, you have to clear your part two and then and only then you can get a visa. There is no other way, but I'm sure
Um,
there might be some loophole. I don't know.
well, the thing is that I don't think so. There is any way apart from clearing the part two. The only
Uh-huh.
other way is a student visa.
Yeah.
Coming here and then enrolling into
Hmm.
a course here in one of the universities in Australia and then
Hmm.
preparing for ADC at the same time.
Hmm.
If you ask me, I would not recommend that path because then you have an additional
Hmm.
burden up to you, right?
Hmm.
Because you have to go through the classes, you have to attend the university, do their work, do their
Hmm.
course, go for
Hmm.
their exams, which is basically not helping you in any way
Yeah.
for your in your situation as a dentist.
Hmm.
But
Hmm.
if your aim is to sit here in Australia and just be here and think of
Hmm.
ADC later, that path is good. Although there is no
Hmm.
harm in doing that path. Of course, a lot of
Hmm.
candidates, a lot of dentists do that.
Hmm.
But I don't think so. That would be
Yeah.
something um, reasonable, in my opinion.
Hmm.
But again, like I
Okay.
said, it's not only my
Hmm.
opinion that matters. You have to look at
Yeah.
your circumstances, what suits you best. If coming to
Yeah.
Australia on a student visa, staying here and then appearing for the practical
Hmm.
exam works for you, definitely go for that. And like you
Hmm.
mentioned, people did mention to you that after the ADC is the sponsorship is available. Yes, that's true. Once you clear the ADC
Hmm.
practical exam, you will have a lot of dentists who will be
Hmm.
willing to sponsor you. If you can't
Yeah.
find anyone, just let me know. I'll find someone for
Oh,
you.
Thank you so
There's a
much.
lot of people here. There are a lot of people that I know in Perth,
Okay.
because currently I'm in Perth and I
Okay.
used to be in Melbourne.
Okay.
So I know a lot of people across Perth, Sydney, and Melbourne who are willing to sponsor you. But the problem is from the immigration side, unless we have the ADC practical
Yeah.
certificate from ADC with your name on it,
Hmm.
the dentists are not able to sponsor you.
Yeah.
But if you don't want to wait for that long and come to Australia before that, you have the student pathway. If that
Yeah.
works for you. Other than that, of
Okay.
course, candidates do come here on spouse visa, partner
Hmm.
visa. So it's all different for every candidate. The situation, the circumstances is different. You can think of what works for you. Being in
Hmm.
Pakistan, I don't think so. That's a disadvantage in preparing for the
Hmm.
practical exam. You can always prepare there. We had a lot of candidates who
Yeah.
are from Pakistan who have cleared the exam and who have moved to Australia after clearing the exam and practicing and preparing while being in
Hmm.
Pakistan. So I don't
Hmm.
think so that should be a problem at all.
Hmm.
You will find a
One
lot
thing
of candidates. In
Hmm.
fact, last Thursday we had 10 candidates who did clear the practical exam,
Oh.
and 3 of them are from Pakistan who are based in
Hmm.
Pakistan. You can also inquire from them, ask from them how did
Yes.
they prepare, where did they
Yeah.
get the material and everything. And I'm sure
Yeah.
something will work out because the majority
Yeah.
of the candidates going for ADC, to tell you frankly, are either from India or Pakistan.
Yeah.
So there is ways out. And being in Pakistan, one
Hmm.
advantage you have is the materials that you buy for the practical will be quite cheaper there, which will
Hmm.
save you a lot of amount of money. All right.
One thing, sir, what
Uh,
I've been suggested is that if you go there in Australia, then it's better that you know the environment, and then you'll be more used to the economics and environment and people, and it will be better and beneficial rather than attempting it and practicing it here from Pakistan on your own.
No, you
Is
see,
that
the
so?
thing is that when I say preparing for the exam in Pakistan, I don't mean that you will do everything in Pakistan and just before your exam catch a flight and come
Hmm.
to Melbourne. No, I don't mean that.
Hmm.
I mean
Hmm.
preparing majority, 80% of your preparation will be done. But once you are in Melbourne, you definitely have to go through a very short course, maybe one day,
Okay.
2 days, or one week to have a refresher to expose yourself to the exam environment and everything. That will be my suggestion to every
Okay.
candidate who is preparing overseas. But
Okay.
that is not an ultimate suggestion because we have
Hmm.
candidates, especially from Middle East countries, which I know
Hmm.
personally, who have not done
Hmm.
any course on site, who have not done anything. They have relied on our practical online course and passed the exam in the first attempt. Few of them
Hmm.
you will see on our academy's official Facebook page. We have videos of them. So it
Okay.
doesn't mean that it is necessary, but then again, like I said, every candidate is different. You will have to see what
Hmm.
works out for you. That's
Hmm.
more important, where you stand.
Okay.
Once you understand the practical exam, the tasks involved in the practical exam, then only you will be able to
Hmm.
analyze yourself. Okay, I'm at this
Okay.
level. Because let's say for the practical exam, let's pick a task like, for example, crown preparation. Some
Hmm.
candidates will take 5 attempts, 10 practice tasks,
Hmm.
10 times practicing the task and will master it. Some will take
Hmm.
50. I'm not wrong in that,
Hmm.
50, 100,
Hmm.
because everyone is
Hmm.
different, right? So you'll have to
Hmm.
see where you stand in the journey. It's not like
Yeah.
the written exam where you have the mock exam, the course content, and everyone needs to go through
Yeah.
the same content. No. Practical exam is
Hmm.
completely different. Some will be good at communication, some will be good at technical
Yeah.
aspect. So you will have to see where you stand from for you to analyze what extra things you need. Understood?
Yeah.
Which will take
Yeah.
time. It's not a one day task. It will take time for you to
Yeah.
get to that path, to know where you
Hmm.
stand, what extra things you need to sort out your visa
Yeah.
things, whether you feel beneficial being in Australia or whether it's better for you to prepare in Pakistan. So you will analyze these
Hmm.
things. So please make sure that you're well aware. That's why I want the
Yeah.
candidates to do the research themselves, even in the written course, even in the
Yeah.
practical. I want the candidates to see what suits them best because everyone will be different,
Hmm.
right?
Yes, sir. Yes, sir.
Okay. Any
Thank you
other
so much, sir.
question you have?
Not right now, but I might come up with questions later tonight.
That's fine. If you have anything, you can always ask me. All right.
Thank you, sir.
Thank
Thank
you.
you.
Thank you. Thank you for that. All right. So who else we have? Dr. William, I can see you here. Dr. Matt,
Hi,
I
Dr.
believe, right?
Raza.
Yeah. How are you?
Yes, I'm
Okay.
good, thank you.
I'm fine. Can you please yeah, okay, that's fine. There you are. All right.
Yeah, I just
Please,
want to say thank
congratulations
you
on
in
clearing your
person.
exam. And please
Yes,
just share your journey, your preparation strategy, the academy's course, and any tips to the future candidates.
actually, all of the aspects are already discussed with the previous doctors, so I don't have much to uh, advise, advise or contribute. So instead of explaining or sharing my ideas,
Mm-hmm.
Dr. Raza, can you ask me what would you like me to tell the
Well, that's true actually, because a lot of candidates have already shared their the course, the materials, and how the course material helped the candidates. What I would suggest you to share is how was your plan on the preparation strategy that you implemented for yourself, which helped you clear the exam.
Yes. I'm not sure about other people, but I am not a smart guy. So I have to go back to the very basic knowledge. So, for example, if I encounter a mock question and I try to answer it, if I don't understand the question itself, I have to go back. What's the idea behind it? So I don't know
Well,
how
there
to
is nothing
explain
wrong
more.
in that. That's perfectly
Yeah.
fine. And that's what we actually encourages, because like I said, every candidate is different. Every candidate
Yes.
concepts is bit different. Someone will go through the questions of the mock and understand it the first time. Some candidates might have to go it twice or thrice, which is perfectly fine because not everyone is the same. And
Yes.
it shouldn't be the same because everyone is made different. Everyone has their own knowledge. Everyone is not fresh from studies, from graduation, right? Some are 2 years apart, some are 5 years apart, some are 10 years apart. I have candidates who are 12, 15 years apart since the day that they graduated. So for them to get back to their concepts, their core knowledge, it takes time. So there is nothing wrong. In fact, this is a smarter way. You started by discussion by saying that you don't think that you're smart enough. I would say you're the smartest guy out here because you used the mock exam and then went through the content and used it smartly. That's what we encourage. That's what our course belief is, that the candidate should go back, understand the concepts, make it clear to themselves, because every question that you have in the course portal, every question, every content that you have, every mock question you have has a reference attached to it, whether in the same mock itself or somewhere in the course portal. So that's something that we always encourage. And I think you have done it very smartly, which helped you clear the exam. All right. Congratulations for that. So
Thank
what
you.
are your next steps? You are currently in Australia, I believe, right?
Yes, yes, sir. Yes.
So what are your plan for the next steps?
I'm waiting to what you are going to tell me, sir. I believe, total believe in you. So I will do
So
whatever
that's
you
fine.
say.
We are
So,
happy for that, and we appreciate when the candidates depend, because we take this not as an opportunity to frankly speaking, making money. That is not our aim. Because some candidates, when I started, as yes, maybe 7, 8 years ago, that was something that might be helpful for us, like when the candidates joins our courses or something. But now we want the candidates to start clear the ADC exam and start practicing as a dentist in Australia. That's what makes us happy. All right. Because to tell you very frankly, out of the context of the discussion, uh, our course fee for the written exam is 1575 AUD, right? Or 1575 Australian dollar. Now, for me to make that money is very easy, because if I do one molar root canal treatment, we charge the patient 1,600, and if we put a crown on top of it, that goes around 3,500 to 4,000. So can you see how easy it is for a practicing dentist to make money in Australia? And all those who are listening, who inshallah, hopefully once will clear the practical exam and start practicing. So there comes a time then it's not only about the money. We want the candidates to succeed. We want the candidates to step into as a dentist, dental career in Australia. And when the candidates say that they depend on us, we take that as a compliment, that they believe in our resources, they believe. And that's, like I said earlier, 1946 candidates have cleared the exams and have been practicing in Australia as a dentist with our help. So that's what makes us happy. So the happiest days of my life is not when I do a root canal treatment and a crown, or do an implant and charge the patient 7,000 and make that money. The happiest days of my life is when the written exam results are declared, and when the candidate's practical exam results are declared, and when we get a message that I have passed. Because you cannot match that feeling when you see someone saying that they have passed, and they have passed through our help. All right. So definitely, yes, we will be helping you with the practical exam as well. And I will be also sharing at the end of this discussion on how we are going to go about it. I'll just brief you regarding the practical, and hopefully things will gain more clarity. All right. Thank you for your time and congratulations once again. And hopefully half the journey is done and the remaining half will hopefully be done successfully as well. Thank you.
Thank you, sir. Thank you.
All right. Who else do we have here? Do we have Dr. Rabina, Dr. Chan? Do we have them here? Dr. Sumedha, Dr. Yoshino, Dr. Simran, Dr. Prateet, Dr. Priyanka, Dr. Amar, Dr. Kainat. Is anyone else here who has cleared the written exam? I can't just spell out all the 79 names. Okay, that's fine. Probably like most candidates did mention to me they won't be able to attend, but that's perfectly fine. Not a problem. Now what I would like to do, thank you for everyone who has shared their experience with the success in the exam. And I'm thankful for everyone who did attend this session, sharing their experience, providing feedback to the candidates. Now what I'll do is in a brief manner, I'll want to answer those questions from the candidates. If I can answer or if those candidates who have cleared the exam can answer, it will be really beneficial. All right. So you can drop in your questions, any questions you have in regards to the upcoming exam, the preparation strategy. I will be happy to answer them. Let me just go through the chat section. Okay, so we have one question. How can you prepare for all the clusters? Like how you manage your study plan to give time to all clusters and topics? Can anyone suggest me how to plan it? Do anyone wants to answer this question, or should I answer them? All right, that's fine. I'll answer it. So the thing is that you don't plan for the clusters. Okay. When you are preparing for the exam through the course, you don't plan for the cluster. You plan for the exam as a whole because you don't know which question belongs to which cluster in the exam, right? So you plan for the exam as a whole so that you are confident and you become confident automatically with all the clusters. Our grand final mock exams are cluster divided. All right, which means that the scoring and the questions are according to the clusters, which will help you. But please remember that you can't plan according to the cluster. Why? Is because every question, every scenario based question that you have in the exam, the sub questions that you have, for example, each case scenario has 5 to 6 questions. So these 5 to 6 questions belong to different clusters. They are not from the same cluster as a whole. So for example, our first question will be what diagnosis or what investigations you will do. That question belongs to clinical information gathering. The second question might be what is the diagnosis? That question belongs to diagnosis and management. The third question can be what treatment or what treatment options you can present to the patient. That question belongs to clinical treatment and evaluation. Then the last question might be regarding professionalism, something went wrong or the patient wants to complain. That question belongs to professionalism and health promotion. So you cannot prepare for clusters. You prepare for the exam as a whole. And at the time when you're preparing for the exam as a whole, you also prepare for the clusters automatically. So that happens behind the scenes. All right. Course needs no change. Mock discussions are self-explanatory. So thank you, Dr. Nikita, for that. Regarding what materials to be read after the course subject and mock exam, there are few extra topics, note, article revision. They themselves have a lot of material to cover. How much are we supposed to cover? Now, yes, apart from the core subject, we have other folders which covers other important content that definitely needs to be read because the topics that you have which are not in the core subjects, they are present in the other folders like the topics, notes, revision, the articles that we have, the professionalism, oral health promotions, so trauma, so certain caries articles. So these things are also very important. It's not just the core subjects you are done, you jump onto the mock exams. No, once you do the core subjects, you have to go through these other folders. Although the content of these other folder is a bit less compared to the core subjects. All right. What did you different compared to your first attempt, Dr. Divya? I believe that she already have answered that in the feedback that she gave. Yes, I completely agree. The WhatsApp group discussions are of great help to get a clarity on the answer. Yes, we always encourage the candidates because the WhatsApp group will be active again pretty soon. We always encourage the candidate to share their questions, share their doubts, anything that they have. Either me or someone in the group itself will answer. Are there any male doctors who have passed the exam? Statistically speaking, do female doctors pass more often? Dr. Yusuf, no, that's not true. Your second part of the statement can be considered true because there are more female dentists appearing for the ADC exam. So that's why you will see more female dentists clear the ADC written or the practical exam. And even with our academy, we have seen the candidates, most of them are female, whether they are with respect to the written or the practical. The only reason is that the candidates who apply for the ADC, most of those candidates are females. And I think in the annual report that the ADC released, 71% of the candidates were females. So I think that answers your question. So it's not that the female doctors have more chances to clear the exam than the male. The only reason is that there are more female dentists appearing for the exam rather than the male dentist. All right. Are you doing part two today, Doc? Yes, after this, I'll just brief with the part two. I'm sure even though this cannot be answered accurately, could anyone outline how long or how many months to spend covering the core subjects and how long prior to exam should we start preparing for the mocks? Now, the core subject content, I would say make sure that at least 2 to 3 months before your exam, you are done reading it at least once. Then you can jump onto the mock exam and the mock website, and then you can use the core subject as a reference cross-checking. Like we had Dr. William mentioning it, that you have to study smartly. So you start the questioning after that, and then whenever you have a doubt and you want further clarity, you go back to the core subjects or any other folder of the portal and check for your answers and discussions in regards to that. Thank you, Doc. Actually, I filled in one cluster health promotion in March. That was my first time, although I tried to go through everything once, and mock exam helped me a lot as there were similar questions. I wasn't able to give proper time as there was a lot of personal distraction going on just before the exam. What plan can I go this time? Now, of course, you have answered your own question yourself in the chat. If you didn't have time to go through that content that was important last time, make sure that you don't miss out on them this time. The health promotion folder has been very comprehensively updated as well. In fact, the entire course portal has been updated after the March exam. We have added a lot of new questions. We have updated everything according to the new therapeutic guidelines in infection control. The mock website answers have changed. The past questions collection in the folder in the portal have been changed. Everything is updated. New references, new pictures, new answers have been given with detailed discussion. So make sure that whatever you have missed in your previous attempt, you don't miss it at this time. Because in the ADC, the margin of error is less. I don't want candidates to regret later on that something that was available in the course portal, in the course content, and they did not go through it. And because of that, they failed. That regret is very difficult. That's a very hard pill to swallow, right? So make sure those things that you have missed earlier in your previous attempt and you have not covered it all, make sure that you cover it this time. Go through everything in the course portal. Like I said, there is a lot that goes behind the scene because you just see the course portal and the mock website, but we are here sitting late at night, updating everything, adding new questions, adding new answers, adding new references, updating the material, because that's how ADC actually works. And now we have the March questions as well, which we will be solving. It will take us a lot of time. We'll be solving it, we'll be updating it, we'll be answering them, and then maybe adding it in the course portal or in the form of the mock in the mock website. Sir, I want to ask how much are unscored question, and if there are 70 questions, how much correct to pass in each cluster? Now, that's a very difficult question to answer because unfortunately, ADC does not disclose the number of questions, although they say in the written exam handbook 40 questions are unscored. But as a candidate, uh, no one will know what those 40 questions are and how many questions needs to be correct for you to pass the cluster. No one, no mentor, neither me, neither any candidate, neither anyone in Australia except ADC knows this answer, unfortunately. So the aim should be to answer most of the questions correct, but that does not mean that all the question needs to be correctly answered. There is always, of course, a margin which ADC does understand. So you don't need to score all 240 questions correct in the exam to pass. No, that's not true. There is always a leeway space. And of course, those candidates that we had who have successfully cleared a huge number of candidates, they did not all answer all questions correctly, right? Sir, for the September appearing candidates, June month supposed to be booking. Anything we have to no, ADC will email you with all the details regarding the booking. Make sure that your initial assessment is done. You just need to go to the ADC Connect website and apply for the written exam. They will email you with all the details. How much preparation we must have done before booking exam, as mock website starts in July. No, the mock website does not start in July. The mock website is functional 24 hours a day, 365 days a year. All right. So it's functional from the start, but we don't encourage the candidate to just start with the mock website. We want the candidates to build core knowledge first and then do the mock website. The TG folder in the course is TG4. Everything in the course is TG4. In regards to the revision we have for TG, the mock we have for TG, and the TG folder itself is according to TG4. Everything has been updated. Thank you, Doctor. Do you know general pass rate exam for 2026 March? I don't really know the general pass rate for the March exam. We had a huge number of candidates. Our best record was March 2024. And the next best record was March 2026. So if you are asking me from the Academy's perspective, yes, this was the best record that the Academy had in compared to the past numbers. We had a huge number of candidates who passed the March 2026 exam. The next best was the March 2024. But we'll only know the overall general pass rate by the mid of 2027 when the ADC releases their annual report on the ADC website. Other than that, no one can give you that number as an accurate figure. If anyone does give you that number, they are probably lying. All right. Okay, that's fine. Thank you for that. And of course, once the WhatsApp group is active, you can ask more questions there, and hopefully you'll gain more clarity. Now let's come to the second phase of the reason for this session today is the practical exam. Now, please remember, with the practical exam, things are very different compared to the written exam. Now, all those candidates who have passed the exam, the written, and who are in the session, if they have any question to ask me, you don't need to, drop it in the chat section or anything, raise your hand or anything. You can just ask me the question straight away and I'll be able to answer that for you. All right. Now, with regards to the practical exam, the journey is very different, right? Because the practical exam basically relies on 2 days of the exam, which is the clinical day and the technical day, right? The technical day is basically when you have 6 tasks to perform on the mannequin, and the clinical day is basically 10 tasks. 6 of them are communication, where you talk to the patient directly, and the remaining 4 are technical OSCEs, where you perform certain tasks like rubber dam, LA extraction, scaling, things like that. All right. So that's what the practical exam is about. Okay. How the preparation should be done, it's going to be very different for everyone. All right. Because not everyone is in Australia. Everyone is in different parts of the world. We had candidates from 17 different countries who cleared the March 2026 exam. So you need to see what works for you and how you are going to prepare. All right. Certain things that I would definitely advise is, first of all, let me just show you certain things that it becomes easier for you to go through. I'll just share the screen so it becomes easier for you to see. All right, can everyone see this one? Can you explain how to choose practical exam date, where to begin? Do you recommend doing home setup first and start the course? Okay. I'll answer that for you. Okay, just a short break. So this is this is the Academy's YouTube website, right? This is regarding the written exam. We have a lot of videos which will help you. Now, coming on to the second part, which is the practical exam. Now, we have an ADC practical exam course orientation. It's for 30 minutes. Please make sure that you have gone through this, because it explains to you the entire practical exam, the tasks involved, and our Academy's course that we run for the practical exam is completely briefed in here as well. So make sure that you do watch this. This is a private video, which all the candidates who would like to watch this, just make sure that you drop us a message and we'll share the link with this regarding this orientation video. It will brief everything in regards to the practical exam, which will make things very easier for you to understand. Okay. Now, the other thing that I would want to show you here is also, let me just get this out of the way. Yes. Now we have this practical exam section on the Academy's YouTube channel in regards to the practical exam, starting the journey, the mistakes the candidates make. And there are a lot of different topics discussed, the success sharing of the candidates who have cleared the practical exam with the Academy's courses. So there is a lot of things going on in the Academy's practical section of the YouTube. Make sure that you go through each video. First of all, starting with the orientation and ADC practical exam, starting the journey. This is how you will be able to first know what the ADC practical exam is about and how you can, the recommended ways that we have suggested in starting the journey for the practical exam. All right. Then you can analyze when you would like to go for the exam. My opinion is 5 to 6 months of thorough preparation is required for the practical exam because there's a lot of tasks which you need to master. Like I said, the content, the amount of things that needs to be done for the practical exam is less compared to the written exam, but it requires a lot of perfection, which takes time to achieve. So that's something that you need to make sure to remember, because that's where your time will be consumed in perfection the task, in making sure that your task fits into the ADC marking rubrics. All right. So these are the basic things that you need to first make sure that you go through it. And then, of course, you can decide on, because the practical exam is divided into 3 periods, period 1, period 2, period 3, and ADC will tell you which period you are eligible for, and then you can apply. So briefly speaking, period 1 is January to May, period 2 is May to August, and then period 3 is August to December. So you can see which period you would like to sit for the exam. Okay. In regards to how the booking happens, it's a different way compared to the written. For the practical exam, first you apply for the practical exam, all right? And then you apply for the date of the practical exam, which is called as the booking period. So the date of the practical exam, you will have the opportunity to select your preferred date to sit the exam. ADC is not going to force you to sit on a particular date of the exam. The practical exam is held every week in Melbourne. So you will have to see which period and which month. For example, you want to go for period 1 2027. Let's assume period 1 is from January to May, but you would like to sit the exam in April, let's assume. So once you apply for the period 1, which is the application period, then the second part after a few days or a week will be the booking period. So which means that in the period 1 from January to May, you will have the opportunity to select your preferred week, date or month. But you have to be a bit fast with it, because there's so many candidates and your desired date to sit the practical exam might not be available if you are slow during the booking period. Okay, I hope that answers the question that someone asked me regarding the practical exam and how the booking happens. All right. The second question that someone asked me, do you recommend doing home setup first and start the course? Please remember, the home setup is going to be your best friend for the practical exam. It's the only thing where majority of your preparation will happen for the technical and most of the technical OSCEs. So the home setup, irrespective of what course you take, irrespective of how long the course that you are going to take is, all these things don't matter, irrespective of when you plan to sit for the exam. The home setup is the first priority, because, or a clinic setup, right? So for candidates who will be practicing in a clinic, they can also practice on a mannequin in a clinic by attaching the mannequin to the dental chair. So home setup either is a home setup that you have at a home or a home setup that you have at a clinic. The only advantage with the clinic is that a lot of things you might not need to purchase. For example, the slow speed, the high speed, the dental unit itself, because your dental clinic might already have all those things. But if you're practicing at home, you might have to purchase those things, right? So that's the only difference. Other than that, the home setup is the same for the ones who are practicing at home and the ones who are practicing at the clinic. All right. But yes, this is the most important thing. From where you can get it, there are 2 websites, One Dental and Nevada. When you watch the ADC practical orientation video and starting the journey video, you will get the links to this website, which will help you order things from there. They deliver worldwide to any country you are in. They will deliver. The second option for the home setup is from getting from candidates who have recently cleared the practical exam and who are selling that, which will help you get that at a bit cheaper rate. But please remember, the investment that you put in a home setup is not going to go waste. Hopefully, once you are done with the practical exam, there are hundreds and hundreds of candidates who will be willing to buy it from you. All right. Sir, is there any hands-on if not home setup? It depends. There are hands-on. We run a complete online course for the practical exam, a very successful course. We had a lot of candidates who have cleared the exam with our online course, because you always need something that is there with you 24/7. With the on-site course, you attend the on-site course, you're done and dusted, you come home, you're totally independent. With our online course, what happens is that the things, the videos and everything is with you 24/7. So whenever you are stuck, you need further information, you don't know what to do ahead, the course is available to you. But there are a lot of hands-on academies in Australia, in India. India one is Chandigarh. I know them very well because the mentors over there have been my students in 2021, 2020. So I know them really well. Then we have some in Melbourne, we have some in Sydney for the preparation. So you can always decide what you would like to go ahead with, right? So you have to smartly prepare for this practical exam. But yes, there are on-site options available. When I was in Melbourne, I was also delivering this in partnership with Dental 101. But since I've been moved to Perth, I have been relying on the online course for the last 2 to 3 years, which in fact is complete course that gives you a complete idea about everything that is needed for the practical exam. Doctor, should I message here for the link? As you said, these are private videos. No, the only thing is that is private is the practical exam course orientation. This is the private video. The practical exam other videos are available on the Academy's website. Just type on our channel, which is ADC Exam Mentoring and Coaching. This is our channel, and you can watch these videos. These are not private. Just the orientation video is private because there are certain private links that have been shared here. That's why we have not kept it public. But all the other videos that you see here on this page, they are all public videos available to everyone. All right. Any other question in regards to practical that you would like to ask me, please? Anything that is not clear to you? Yeah, please.
Sir,
Yeah.
by private, you mean the ones who've bought the practical course, right?
Sorry, I didn't understand. Can you please repeat?
You said some of the practical videos are private. Private means for the ones who
No,
bought the
no,
practical course.
private. No. Private is this practical course orientation video that we have. This is the only private video. Okay. The
So that's for
practical.
us as well, or the only ones who have bought the course from you?
No, this is for everyone. This is our
Okay.
practical course orientation and about the ADC exam, the practical
Okay.
exam. So
Okay.
this is for everyone. The course that we have, that is a
Oh, yes.
completely different thing. That has
Okay.
thousands of videos and things like that. That's a
Okay.
complete different website. But it will be briefed here as well. In this video, we'll show you that as well. Okay.
Okay. And would you say it's better to have an hands-on experience, or is it okay, but we can go for an online thing and then just go with sitting the exam? But the problem is you're giving an online session, the entire practical, and then how would I be attending a in-person?
Yes. Now the thing is different. It depends what you will need. Like I answered earlier as well, every candidate will be different. Some completely rely on the online course. There are two reasons for that. One is because they're not in Australia, so they don't have any other option. They can just come to Australia for exam, and because they're so busy with work and everything, they don't have that much flexibility with days off from work or anything. So they rely on the complete online course and sit the exam, and that's more than enough for them. Some candidates, they rely on the complete online course. Few weeks before the exam, they come to Melbourne, attend an on-site course. All right, either
And you do provide an on-site course as well?
not directly, but we have partner academies which we will refer you to
Okay.
for that
But
in Melbourne, because you'll be
it's
coming to Melbourne for the practical
yes,
exam,
yes,
right?
yes, yes.
So you
Yes.
will want to
Okay.
have something that will be in Melbourne itself. You don't want to travel to other paths.
Yes.
So then you will
Okay.
see whether once you start practicing on the home setup, you will see whether I need any help with technical tasks. Communication, definitely you will not need any help because communication
Okay.
is completely covered Like
Okay.
that's online anyways. That's not
Okay.
on-site. The only thing is the technical, which is on-site, if you need one, because most of the things you'll be able
Okay.
to practice and master at your home setup itself by watching the videos, the assessment videos that we have. It's a very thorough
Okay.
portal that we have for the practical exam. So that will be enough.
Okay.
But if you say, no, I want more practice with technical OSCEs. Technical OSCEs are like things like rubber dam, extraction, LA, medical emergency. Then you can attend a 1-2 day refresher course for technical OSCE
Okay.
when you're in Melbourne. So you'll have to work out the thing. So that's why you first need
Okay.
to know what the practical exam consists of for you
Okay.
to be at a stage to decide what extra things you need.
Okay.
Okay.
And that will be separate and charged separately
Yes, it will be all
alphabetically. Okay.
separate. Yeah.
Okay.
Cost for the practical course, we have different options for the practical course. Please message and ask for the course brochure.
Okay. Okay.
So someone has asked me for the cost for the practical course in the WhatsApp in the chat section. We have different option. Of course, the candidates who have cleared the written exam will be going with the complete course because that contains everything. So you can always check the brochure on the Academy's website or even WhatsApp us and we'll provide you the brochure and
Okay.
then you can decide what you want to do.
Okay. Okay.
Will the
Thank you so much.
Academy's practical exam course supports until we take the exam? Yes, once you enroll into the Academy's course, you will have task assessment videos already in the course portal. So you will have each task, how to do it, and then you will have a video on how to assess it according to the ADC marking rubric. But more adding to that, you will also have the opportunity to share the task with us for us to enable point out mistakes that you might have missed. So that option is also there in the course portal. But again, most candidates might not need it. Like I said, we have task assessment videos for each task of the practical exam in the course itself. All right. When is the best time to participate in your practical exam course? I have passed this March written exam. If you have passed the written exam, congratulations, and start the exam start the preparation as soon as possible. Why wait? There's no point in waiting, right? If the next part of your journey is the practical exam, what is the point in waiting even for a single day? All right, because our courses are available until the candidate sits for the exam. So why not start and prepare and see how things go? Because it will take you a lot of time first to understand the task, watch the videos, understand the practical exam. So just get started. All right. How much would be the fees for the technical task, doctor, in Melbourne, which you just mentioned? It will depend on the need, right? So some candidates will go for 1 or 2 weeks course. Some candidates will go for 1 and 2 days. So the price will vary hugely, right? So when you decide what you will need, then only the price can be discussed with that, right? So what will be the cost for the partner onset academy as well? The same answer I would give. It will depend on what you need and how much you need, and that will decide the price, right? So I can't just give you a value for that because you might not need anything. You will say, no, I don't want any on-site course. I want to prepare and sit for the exam. I'll prepare at my home setup. You will say, no, I want some refresher for the technical task and the technical OSCE. Or you might say, no, I don't want technical task. I just want technical OSCEs, which are the 4 tasks which are asked in the exam. I want practice for that. So it will depend what you need, right? So that's why the answer to this question cannot be answered pretty straightforward in a figure. Okay. Any other question, please? All right, that's fine. So please make sure that this is just a brief overview, but you will have a lot of other questions in regards to the practical exam later on. But please make sure that you, as a base to start with, like I always say, there is some base that you need to establish yourself on. And after that, you launch yourself. So first watch the orientation video. All right. Go through the ADC website, have all the practical exam handbook, assessment, material package, information package downloaded, read them, go through this video, go through the other videos that we have. This is where you will develop an understanding. Okay, this is the practical exam. This is how it works. This is what I need. These are the tasks. And then decide, okay, next step, home setup. Now, the first video actually we have here, the ADC practical exam starting the journey. This is very valuable video because it gives you an idea on what to do after the candidates clear the written exam. It's a stepwise. I think I've divided the steps into 4 or 5. Make sure that you watch this one. which will give you a lot of clarity. All right. But again, like I said, it's an ongoing journey. It's a learning curve. You cannot just absorb everything in one day or 1 week. It will take you time, and then you can decide what helps you the most and what should I be doing. Okay. Any other question, please? Sir, in practical exam, how many stations correct in order to pass? Again, it is different because the practical exam is marked on a cluster. So you will have to see the different clusters that are available, right? So it's not that you have to pass everything, but you have to make your best and do your best for most of the task of the practical exam, right? Okay, but again, it's not 100% that you need to pass all because there are 16 tasks. 6 tasks are on mannequin on the technical day. 10 tasks are on the clinical day. Out of those 10 tasks, 6 are communication, 4 are technical OSCEs. But that does not mean that everything needs to be passed. Okay, there is always a margin of error. Will you share the orientation video here, Doc? The orientation video that I just showed you, this one? On the website, or which one are you talking about? Are you talking about this one? Yeah, this will be shared. Just WhatsApp us and we'll share the link of this to you. All right. But this one, like I said, you can just visit the YouTube channel of the Academy and you will have all these details given to you. Okay. Any other question? All right, that's fine. Now, please remember, you'll have more questions later on. You will have more doubts, more queries. More than welcome to message us. Any questions you have. First, make sure that you go through everything that I've said regarding the practical exam. Watch the orientation video, download the handbooks from the ADC website regarding the practical exam. Watch our different videos regarding practical exam on the YouTube channel. Once you have done this, if there is still any question that you want to ask me, please more than welcome to ask me. All right. Sir, I want to ask, if I pass part 1 is passed, can we get dental assistant job? If you're in Australia, yes, you can work as a dental assistant, but if you're overseas, you cannot be sponsored to come to Australia as a dental assistant because the Australian immigration does not allow for dental assistant to come to Australia. You have to be either in Australia on a student visa or any other visa, and then you can work as a dental assistant, but no one is going to call you from overseas to come to Australia to work as a dental assistant because that is not allowed. All right. All right. Thank you so much for everyone attending, everyone sharing the experience. It was Sunday. I do understand it was not easy, but those who did attend and provided their feedback, thank you. And I hope I hear from all of you guys soon. Thank you. Thank you.